at the age, I would say onset was 18 years old, officially diagnosed with Crohn's at 19. Had my first colon resection at 21. 7 years later, I had another one. 7 years later, I had another one. A year after that, I had my gallbladder removed. They call it a silent disease for a reason, right? Because patients who have this disease suffer in silence because of the sensitive nature of the topic. So I would say bloating, blood in your stool, chronic fatigue, lost weight, multiple bowel movements, 10, 15 a day. So you're not able to do things like the average person is able to do. I don't usually go to sporting events or concerts or anything like that because of the inability or the stress and the anxiety that it will cause. So I just don't do it, right? So I've lived a lot of my life indoors. So everyone's like, wow, you look great for 50. It's like, well, I haven't done anything. I don't go anywhere. I don't do anything. A year after my second kid, had another surgery. Unfortunately, got divorced, and I'm certain that the disease had something to do with it, because when you're chronically ill, it's just part of it, right? It takes everything from you. It takes your personality, it takes your voice away. 2 years ago, I started working really hard on trying to get the disease controlled, right? And so 2 years ago, the doctor said, hey, you have no active Crohn's disease. And here I am 2 years later, even though there's no active Crohn's disease, the disease is still controlling my life. So earlier this year, Sean and I partnered together, and it's been 5 weeks, and everything that my doctor said I couldn't have, I have. So it's been a journey. It's not easy, right? But being chronically ill isn't easy either. So you have a choice. You either change your lifestyle, right? It's not a diet, it's a lifestyle change. But part of that lifestyle change is having a support system. It's been, like I said, hard, right? But not as hard as my last 30 years have been, if that makes sense. So I'm celebrating my 50th year on this planet at the end of the year, and I just don't really want to live the second half of my life the way I lived the first half of my life. They've seen me at my lowest lows, right? And I dictate a lot when you're laying horizontal on the couch, get me this, get me that. Well, now I'm the one that's able to be a parent for them, right? I mean, they've been kind of caring for me over their whole lifespan. And so it's time that I take care of them for a change, if that makes sense.
What we do here is we look at extensive diagnostic testing, digging deeper than everyone else to find the causes of the problem. We then take each patient's test results and we customize a diet specific to that one patient and an all-natural treatment plan, utilizing those test results and scientific research.
It's a great experience. It has literally just stripped me of all my dignity, and now I want my dignity back. And I want my control back. I want to control it, right? Every day I feel better and better. I've had people say, wow, your skin looks better and your complexion looks better and you don't look gray and you're always in a good mood and not irritable, right? You know, when you're not feeling well, you're irritable. I don't have brain fog. I couldn't even remember what I was going to do tomorrow. It's helped me with my business. It's helped me with my kids. It's helped me with my relationships. I never thought I could feel this good, because the doctors have always told me, you're never gonna have a solid bowel movement, you're never gonna get off this medication, you're always gonna have to do this. I partnered with the Crohn's and Colitis about 7 years ago. I'm a board member, and I've met a lot of really, really like people, right? It's like, holy cow, there's other people out there that are suffering like I am. So that's been a huge help. But I wanna take this journey very quietly, and then at the end of the year, present it to my cronies, right? To my fellow cronies, and say, well, you know, we've been doing it this way for this long. I'm not saying that the doctors are wrong, right? I'm just saying there might be another way. Sean dug deeper than my doctor ever has. About 4 weeks ago, we went through all of my medical results. So we did stool sample, saliva test, and then blood. And I knew it was gonna come back not perfect, right? But I didn't realize it was gonna come back really not perfect. And I got emotional. And I just kind of looked at him. I was like, I don't know why I'm so emotional, but I really need to pat myself on the back, because I can't believe that I've done the amount of stuff that I've done in the last 30 years and silently dealt with this. My mom always says, you sure do put on a brave face. You don't look like you're sick, right? I mean, what does a sick person look like? Dr. Branham had been invited to one of our board meetings for the Crohn's and Colitis Foundation. And so when he had spoken to us about what he can offer all of the IBD patients, I reached out to him to dig deeper into what he had to offer. And it has been absolutely amazing. I've called him when I've had some bad moments, right? He's very knowledgeable. He'll repeat things as many times as you need them repeated. He won't browbeat you if you do something wrong. He'll just say, so did you learn a lesson? Because I've cheated a couple times and I've paid for it, right? So he's not judging me. Whereas most of the time when I go to a physician, well, why did you do this? Why did you do that? So it's a different approach, right? And I've never had anybody really dig deeper into what I need. You know, I've been usually grouped into as like a whole. Well, this is what we do for the mass, right? But here's what we're gonna do for Kelly. I found out I was allergic to eggs. Eggs! And I was eating eggs every single day. Nobody ever once did an allergy test on me. Eggs! It's been a great journey so far, and I'm just excited to see what we're gonna do for the rest of the year.